Firstly, today I want to sincerely thank Dr. Andrew Forrest and all those people involved in the procurement effort of equipment coming down from China last night and continuing. This has been in collaboration with the federal and state government, and the AMAWA is proud to be involved in the organisation and in the distribution of some of the equipment. Dr. Forrest has always been a game changer, and that's what we need. We need to change this game because the virus is playing the same game here as it has around the world, and there's only a few levers that we can pull in order to get ahead of it and succeed where sadly other countries have not so far. The boost in the availability of protection equipment, N95 masks in particular, is going to have an immediate impact on the morale of those on the front line. This is the first piece of good news that they've had in many days since this thing started. The safety, the training for people in first response, in general practice, in aged care, public, private hospitals, all across the system, this is a fantastic morale booster that we really, really need right now. It's important that our healthcare workers receive the appropriate training to use this gear. Anyone who's familiar with working in industry will know that you don't get on a job site unless you've had induction, unless you've got the right safety gear. And that's exactly the same for our people, because we want them to stay alive so that they can keep you alive. We'll be working with the government and all of the providers and Dr. Forrest and his team to make sure that that happens. And if we see things that we don't like, then we'll be unashamed in calling that out. I'd like to say a few words about testing. The government's done a lot of good things recently, a lot of things that we've been calling for a while. The government has been happy to put into place more recently, and we congratulate them on that. In particular, the schools, the travel restrictions, the borders, and reducing public gatherings down to 2 people. These are all incredibly important things, and they're buying us important time. We don't take a lot of optimism from the lower numbers of cases. What we do is we say, great, that is giving us spare time now, because we know that once this thing gets into the wild, into community spread, then we're really going to see it moving around. On that front, we need more testing. The obvious way to have more testing is to allow the private pathology providers, who are much, much bigger in their combined capacity than PathWest. Good though PathWest is, fantastic operation, nothing wrong with it, but it's small and it's government-based compared to the private pathology providers who are ready to go, ready to test in your neighbourhood right now as soon as the doctor says you need the test. We just need the government to loosen the reins a little bit there. We know that the World Health Organisation says test, test, test. If we are going to get to a stage where we start to ease some of these restrictions, start to get people back into being able to move around a bit, do a bit more work, the only way that that can be done remotely safely is if we can test anyone who every doctor thinks needs that test done. There's a little bit too much control around this has to be done at a COVID clinic and it has to be run through a government centre, and we're controlling all the numbers of people who get tested. So while we welcome the expansion of the testing criteria, it's not nearly enough. The obvious thing is turn on the taps. They've got the reagents, they've got the swabs, they've got the labs ready to go. Let's just drop this little bit of bureaucratic control that seems to be going on here and get on with allowing the community to have what they want, which is convenient access to a test through their own doctor. Particularly now that we're going to have additional testing kits available through Andrew Forrest. The drop in the restrictions looked better than it is. I thought that it meant that anyone with a respiratory illness and fevers was going to be able to go and get the test done, but actually you have to have the fever at the time that you arrive at the COVID clinic. That's too restrictive. If someone comes in with a history of having had sweats with a respiratory illness, any member of the community should now be able to get the test, and they should be able to get it done through their doctor and any of the many pathology providers who stand ready to provide this service. We don't understand why the government won't do it, and we're asking them to step up. In regard to the guardianship bill, which is going through the Parliament this afternoon, I'm gratified to see that the first reading is passed now in the upper house as we speak, 23 votes to 4 on the second reading. And now it's going into committee discussion, at which stage people will suggest amendments. I have a great deal of respect for the Legislative Council in Western Australia. We, of course, have had a lot of conversations with these legislators throughout the last couple of years. The guardianship bill was sitting on a shelf for a while. There was work going on with it, and the Attorney General's done a great job to now get it ready to go into the Parliament. It's been a lot like herding cats, I know, for the Attorney General, and he gets our thanks, as do the government for introducing it. I would say to the Legislative Council that we respectfully request that you put it through as the government have presented it. If we do put a sunset clause in there, such that unconscious patients, we need to find their relatives before putting them in a trial, that may limit our ability now to treat COVID patients with experimental treatments, because we may not be able to get ethical approval and funding for trials that are going to take longer than 2 years, and a lot of these trials can run for 5 or 6 years. So we can understand your concerns. It's been dumped in the Legislative Council at the last minute in the midst of a crisis. We know what that's like. We respectfully request you put it through as it is, and we remain available 24/7 to talk to any legislator who has concerns about that and wants to talk to doctors on the front line who will be implementing it. In regard to the cruise ships, I'm concerned, like the Premier is, firstly, that anyone who's sick, any human who's close to us who's sick, gets the best appropriate treatment for them. That's just the way it works in medicine. You don't care where they're from, you look after them. Now, there are a number of sick people that seem still associated with this cruise ship. If we do need to look after them in Western Australia, our request is that this be done in the most appropriate facility, the one that's the most ready, irrespective of politics, of which arm of government's responsible. We just want them looked after the best they can. We're closely in touch with the Joondalup Health Campus and the staff that are working there. They're doing a magnificent job, but they're stretched already with the patients they've received. They are one of our flagship facilities as far as dealing with this is concerned in terms of experience, and the rest of us are looking at them, learning from them, being briefed by them so that we can start to get ready. The other hospitals in the private sector, so that down the track, if we do have to take COVID in those hospitals, they'll be ready. That will take some weeks. So if there is to be an overflow of cruise patients, at this stage, the only appropriate facilities are going to be the large public hospitals.